Assalamualaikum and hi madam, my name is FATHIYAH MUSTAFA A1869669. I am from group 7 and will present about health effects of cigarette smoking. And now I will continue to share with you about the effects of smoking to our body. First of all, there are many causes which make people smoke and the effects of smoking to the health. Although smokers can claim that it helps them to relax and release stress, but the negative aspects of the habits take over the positive. As it has been stressed by the scientists and experts, there are some very severe reasons of smoking, but its crucial consequences should also be taken into consideration. However, it can divide to two main causes, which in physical and psychological. First cause, which is physical concern to the human bodies, which is needs such like nicotine. Nicotine content in cigarette is an addictive substance. It is the chemical which cause addiction. Nicotine reduces tension in the muscles and allows smokers to relax so they can feel that they can release stress by smoking. A little nicotine makes smokers feel more energy and improve their concentration. Second main cause of smoking is psychological, which seems to be a very important factor for people to get the habit. One of the psychological situation which drive people to smoke is low self. Okay, next, smoking not just can cause to the smokers, but it also can give the effects to those who are not smokers by it smoke, which are released by cigarette smoking. Actually, we need to give more attention to effect of smoking to the non-smokers because they get the serious effect than the smokers. Everyone can be exposed to smoke in public place, such as restaurants, shopping centers, public transportation, schools, and daycare centers. The American Cancer Society (ACS) describes two kinds of tobacco smoke that could affect non-smokers, namely side stream smoke that issues from the burning parts of the pipe, cigarette or cigar, and mainstream smoke which is exhaled by the smoker. Both are called environmental tobacco smoke (ETS) or second-hand smoke (SHS). Second-hand smoke can also cause cancer to the non-smokers. Second-hand smoke contains a higher concentration of these carcinogens than to smoke inhaled by smokers. It can also cause the respiratory problem and heart disease to non-smokers, even they are not smoke themselves, but it can also cause to them. Furthermore, it also can give the effects to the pregnant woman, which cause the pregnancy complication when the mother inhale the smoke from smokers. I think that's all from me. Thank you. Now I will pass to the next presenter for the next segments. Thank you.
Hello everyone and good morning. My name is ASYRAF HAMZAH and I would like to present ways to avoid getting disease caused by smoking. Before that, I would like to thanks to my friends who share about the effects of smoking on our bodies. Okay, first steps to avoiding and getting disease from smoking is to first we should stop smoking first immediately. This is because quitting smoking is the first step that all smokers need to take in order to avoid getting disease from smoking. Okay, as we know, it's still quite difficult from smokers to quit smoking immediately, but they can get help from health professionals to help them quit smoking. Subsequently, some smokers have developed illness from smoking, but including heart disease, lung failure, and internally organ damage. Although it is not a chronic illness, it can be quickly healed. Smokers can also develop illness eating a balanced diet by adhering to the food pyramid is the one of the healthy lifestyles. So in addition, we can engage in sport of leisure activities since they improve our bodies and naturally state and help our bodies is expel harmful toxins that come from smoking. Okay, that's all from me. So let's help smokers who want to quit smoking and want to live healthily life, but by helping them get the right and easy way for them to follow. Thank you.
Thank you to the presenter of the previous segment about how you can avoid getting sick from smoking. Hello everyone, my name is NURSAYYIDIE bin NAZIR. Let me proceed with my point, which is the effect on people who are smoking in their daily life. What are the conditions may be caused or worsened by smoking? As we know, everyone is aware that smoking is very dangerous to their health, especially because it will cause complications in the body such as heart, lungs, and others. In addition, for every people who die because of smoking, at least 30 out of them have life with a serious smoking related illness.
Here, I would like to emphasize the extent of the condition of people who smoke cigarette. According to the Lancet Respiratory Medicine, it states that individuals who are secondhand smoke did not realize that they were facing the effect of smoking and the risk of developing problems related to lung disease that could be fatal. It should be noted that the characteristics of lung cancer among smokers and non-smokers have many differences. Usually, people who smoke do not inhale deep smoke. They just inhale a little and exhale. So, the cigarette smoke doesn't enter the inside of the lungs and rather just the outside. If cancer does occur tough, the symptom will come early. Only cancer will be more aggressive. Compared to passive smoker, those who are exposed to this cigarette smoke will inhale to the inside of the lungs. Cancer that occur is difficult to highlight any symptom. However, it occurs on the periphery of the lungs, not in the center, as experienced by cancer patients who are active smokers. Smokers with lung cancer will usually show clear symptoms such as cough, bloody cough, tiredness, and difficulty breathing. But for passive smoker, cancer cells that grow on the edge of the lungs make it difficult for patients to detect the problem from the beginning. In most situations, passive smokers who develop cancer will not face any problem in the early stage, so the tendency for, for them to seek further examination is low. When clear symptoms start to appear, usually cancer cells have already spread to stage 3, 4, and it may be too late to the treat. That's why in most cases involving female non-smokers, they only become aware at a late stage. There are no early symptoms, but within a period of between a month and a year, it has started to spread to the bone and other organs. Therefore, I want to highlight in this segment that condition may be worsened and worsened by smoking. Reflection season. I like to make this vlog because I can add knowledge about the harm of smoking. The skill I got when making a vlog was pronunciation because I lack confidence to make a video. The rate of my ability to speak English is increasing from before I entered UKM. The thing that helped me to improve was to find information on the internet.
That's all from my segment about other conditions that may be worsened by smoking. So I continue with the next segment, which is how a disease caused by smoking can be treated. Therefore, let's see.
Hi, my name is NURUL binti RADZI. So we previously heard about how smoking daily life are affected by my friends. So now I want to explain about my segment about how can a disease causes by a smoking treatment. Cigarettes emit harmful chemicals that adversely affect the heart and lungs, attracting individuals to smoking despite awareness of its danger due to the previous positive effect of nicotine. Addiction can make breaking the habit challenging, with the American Cancer Society noting significant reduction in life expectancy for both men and women who smoke. Smoking is linked to variation disease, necessitating prevent treatment recommended by medical professionals. Cardiologists, lung specialists, and oncology team can addressing smoking-related illness such as heart damage, COPD, and cancer. Diagnosing that illness depends on individual symptoms. For example, a smoker using smokeless tobacco and developing stomach cancer for nicotine content juicing require different testing that make inhaled smoke. Doctor inquired about tobacco use, conduct physically examination, and other relevant tests like electrocardiogram or X-ray to assess organ damage. Study indicated better treatment respondents for smokers who quit and non-smokers facing smoking-related illness compared to those who proceed. Quit smoking offers long-term health benefit, and doctor can effectively treat most smoking, including illness, with providing expert advice on associated health issues.
Thank you, Fatin ALYA, for a very good presentation. And now it's my time to present about my segment. Okay, first of all, my name is Muhammad ILYASA bin JAMAL and my matric number is A1870N28. I would like to talk about my segment on how health problem from smoking are diagnosed. Health problem from smoking are diagnosed through a combination of medical history, diagnostic tests, physical examination. Firstly, one of the best way to diagnose our health problem from smoking is based on medical history. The doctor will ask you about your smoking history, for example, duration and the frequency of smoking. If a disease is diagnosed late, it can lead to several negative consequences, which can cause a lot of trouble. Delayed diagnosis can allow the disease to progress further and making it more difficult to treat and potentially leading to more severe complications. Next is physical examination. For example, the doctor will perform a physical examination to look for signs of smoking related health issue, such as lung sound, heart rate, and overall health. So health problem from smoking can be tried easily. Other than that is diagnostic test. The doctor may do the various tests such as lung function test, chest X-ray, or CT scan to look for a sign of lung disease. This is one of the ways to diagnose our health problem from smoking. If we late diagnose our health problem, it can increase treatment difficulty because late diagnosis may require expensive treatment, can cost an arm and a leg, and as the disease may have advanced to a later stage and make the symptom become worse. With a delay, diagnosis symptom may become worse and difficult to manage, and leading to a decrease in quality of life for a patient. Thank you. I really like making the vlog because I can learn and teach myself to talk, especially in English, which can give me a lot of confidence. And what I dislike when doing this vlog is I get a bad connection issue in my college, so I need to upload many times, and I would like to rate my English speaking ability compared when I was in first year is 8/10 because this year I can get a lot of confidence and I can talk in English without nervous. Next is the skill that I learned is skill to talk with confidence in front of my fellow friend. And what helped me to improve is the assignment block in this class helped me to improve my English, and I do a lot of practice, and I also watch a movie in English to improve my English. That's all from me, and I would like to pass to my gorgeous friend AINA on how to quit smoking with treatment recommended by health agency. Thank you.
Hi everyone, next move to my segment, which is tips to quit smoking with recommended treatment by health agency. Introducing me, AINA NAZIFA BINTI ZULKIFLI, and here I am to present to you guys some methods that are really useful to help other people to quit smoking, and this treatment was recommended by health agency. The decision to quit smoking is for the goodness for yourself and your family health. Sometimes it's hard for quit smoking without any support system, right? So here I would like to share some tips, which is move to the cold turkey. What is a cold turkey? Giving up smoking suddenly with no outside help or support is known as going cold turkey. People who use this method rely on their own willpower to get them through the craving and withdrawal symptoms, while quitting cold turkey does not work for all smokers. Must smokers quit smoking this way? Then, if you want to try it, you will have a better chance of the success if you avoid situation that will trigger a desire to smoke. Distract yourself with new activities, get support from family and friends, and focus on the benefit of not smoking. Second tip is gradually cutting down. This method involves slowly reducing the number of cigarettes you are smoking until you have quit completely. If not as effective as quitting straight away, but it might be a good place to start if you are not ready to quit right away. You can cut down by slowly increasing the time between cigarettes, reducing the number of cigarettes in your packet each day. It's still a good idea to set a date to quit smoking completely and work toward that, as evidence shows that even light smoking poses serious health risks, including cancer. And the last one is nicotine replacement therapy. NRT aims to reduce the cravings and withdrawal symptoms that occur when you stop smoking. Used properly, NRT can make a big difference in helping you to quit smoking. It comes in different forms such as patch, gum, oral spray, inhaler, or tablet. By providing small measured doses of nicotine into the bloodstream, you are not getting the harmful chemicals from tobacco smoke. Reducing physical withdrawal symptoms means you can focus on the situations and emotions that can trigger a desire to smoke. That's all from us. Thank you. Lastly, for my reflection about what I like while making the vlog is I can learn and gain more knowledge regarding how to make a good vlog with a good idea. And what I dislike is I don't have more confidence in front of the camera. And what I learned while making this vlog is about teamwork and also planning in making a good content. And the skill I pick up while making the vlog is about content planning, such as having a clear idea of what you want to convey in our vlog, and planning the content accordingly is important. And next is storytelling. Being able to tell a compelling story and engage my audience is crucial for a successful vlog. My English speaking have a lot of improvement compared to when I first entered in UKM. I have more confidence to speak English with people and used to speak English as a conversation, even though I know there are still have a lot of mistakes.